Sudden death is something that can catch anyone off guard, especially as we grow older. It's devastating to lose someone, particularly when they seemed perfectly fine one moment only to be gone the next. But what if there were subtle signs, warning signals that the body was trying to send out, indicating that something was wrong? Too often, we dismiss these symptoms as a normal part of aging, or something minor that we don't need to worry about. In this video, we're going to talk about 6 critical signs that could indicate a serious, life-threatening condition in older adults. Recognizing these symptoms early could potentially save your life or the life of someone you love. Some of these warning signs might seem trivial or easy to overlook, but they often point to underlying health issues like heart failure, strokes, or fatal blood clots. By understanding these signs and taking action before it's too late, you can make a huge difference in your health. Stick with me until the end, as the last sign we cover is one that many people miss, but is extremely important. This video could help you or someone you know avoid a sudden health crisis, so don't miss it. And if you haven't subscribed yet, make sure to hit the subscribe button and turn on notifications so you never miss another video that could help you stay safe and healthy. 1. Unexplained shortness of breath. Picture this. You're walking up a flight of stairs, something you've done countless times before, but suddenly something feels wrong. You're winded, your chest feels tight, and you have to stop and catch your breath. At first, you might think it's just because you're getting older or out of shape, but the reality is that sudden shortness of breath can be a serious sign that something is wrong with your heart or lungs. One of the most common causes of unexplained shortness of breath is congestive heart failure. When the heart isn't pumping blood as effectively as it should, fluid can build up in the lungs, making it harder to breathe. This condition can develop gradually or strike suddenly. Another dangerous condition to watch for is a pulmonary embolism, a blood clot that travels to the lungs and blocks blood flow. This condition can come on unexpectedly, especially if you've been sedentary for long periods or have recently had surgery. Consider the case of Robert, a 74-year-old retired school teacher. He had always been active, taking daily walks around his neighborhood. But one morning, even a short walk left him struggling to breathe. His wife encouraged him to see a doctor, but he brushed it off, thinking it was just part of aging. A week later, he collapsed at home, and by the time help arrived, it was too late. Robert had suffered a massive heart attack that could have been prevented if he had paid attention to that warning sign of shortness of breath. If you're experiencing shortness of breath after mild activity, feeling breathless while lying down, or waking up at night gasping for air, these could be early warning signs of heart or lung issues. It's crucial to take them seriously and see a doctor right away. Early detection and treatment can often prevent a sudden catastrophic event, so don't ignore these symptoms. 2. Frequent chest discomfort. Imagine sitting on the couch, watching TV, when suddenly you feel an uncomfortable pressure in your chest. It's not sharp or unbearable, just a mild tightness, like someone is pressing down on you. After a few minutes, it fades and you brush it off, thinking it's nothing. However, that moment of discomfort might be your body signaling that something far more serious is brewing. Many people assume that heart attacks only present themselves with crushing chest pain, but the truth is, the symptoms can be much more subtle. A dull ache, mild burning, or tightness in the chest, especially if it comes and goes, could be an indication that your heart is struggling. These symptoms often appear days or even weeks before a major heart attack, but because they aren't as dramatic, many people dismiss them. Harold, 78, had always been in decent health. He occasionally felt a little squeeze in his chest, particularly when climbing stairs or carrying groceries. Since the discomfort went away on its own, he thought it wasn't anything to worry about. One evening, as he was getting ready for bed, the pressure returned, but this time, it didn't go away. Minutes later, he collapsed, and by the time help arrived, his heart had stopped. Looking back, Harold's family realized that those mild episodes were warning signs that his heart was struggling. If you ever feel a strange pressure, squeezing, or mild discomfort in your chest, especially during physical activity or stress, pay attention to it. It could be a sign that your heart is in trouble. The earlier you catch heart problems, the better the chances of preventing a catastrophic event. 3. Sudden weakness or dizziness. You wake up feeling fine and go about your day as usual, but then, out of nowhere, a wave of dizziness comes over you. Maybe you grab onto something to steady yourself, or the room spins for a few moments before things return to normal. It's unsettling, but since it only lasts a few seconds, you dismiss it as nothing to worry about. However, sudden weakness or dizziness isn't always just a sign of dehydration or fatigue. Sometimes, it's a critical warning that something serious is happening inside your body. One of the most common early signs of a stroke is dizziness, especially if it's accompanied by sudden weakness in your arms or legs. This could be a transient ischemic attack, TIA, often referred to as a mini-stroke, which temporarily disrupts blood flow to the brain. These symptoms usually disappear quickly, leading many to believe everything is fine. But a TIA is a serious warning that a full-blown stroke may be coming soon. Consider George, a 72-year-old retired firefighter. One afternoon, he felt lightheaded while standing in his kitchen. His vision blurred for a moment and his left leg felt weak. He rested and within minutes felt fine again. He mentioned it to his daughter that evening, but since he felt normal, they thought nothing of it. The next morning, George suffered a major stroke, leaving him unable to speak or move the right side of his body. The dizziness he had felt the day before was his body's warning, but he didn't take it seriously. Irregular heartbeats can also cause dizziness. Atrial fibrillation, where the heart beats erratically, can cause a temporary drop in blood pressure, leading to faintness. If you suddenly feel weak or dizzy, especially if it lasts longer than a few seconds, don't brush it off. It could be an early warning of a stroke or a heart condition that needs immediate attention. 4. Swelling in the legs or abdomen. At the end of the day, you sit down to take off your shoes and notice deep indentations on your skin. Maybe your shoes feel tighter or your legs seem puffier than usual. While it's easy to dismiss this as nothing more than water retention or the result of standing too long, sudden or persistent swelling in the legs, feet, or abdomen can be a serious warning sign. When the heart isn't pumping blood efficiently, fluid can build up in the body, causing swelling, especially in the lower parts. This is called edema, and it's often a sign that heart failure is worsening. Swelling in the abdomen can also indicate liver problems. Frank, a 76-year-old Navy veteran, noticed his ankles were getting puffier over the course of a few weeks. He attributed it to sitting too long or eating salty foods. But when he began feeling more fatigued and his stomach became bloated, he decided to see a doctor. It turned out he had severe heart failure, and the swelling was his body's warning sign long before things became critical. If you notice persistent swelling in your legs, feet, or abdomen, or if pressing on the swollen area leaves an indentation that doesn't bounce back, take it seriously. Swelling could indicate that your heart, kidneys, or liver aren't functioning properly. If it's accompanied by shortness of breath or sudden weight gain, seek medical attention immediately. 5. Unusual fatigue that appears suddenly. You wake up after a full night's sleep, but instead of feeling rested, you feel completely drained. Even the simplest tasks, making coffee, getting dressed, leave you exhausted. You might brush it off as part of getting older, but this kind of fatigue, especially if it comes on suddenly and doesn't seem to have an obvious cause, could be a sign of something much more serious. Unusual fatigue is often linked to heart problems. When the heart isn't pumping blood effectively, the body redirects energy to keep vital organs functioning, leaving you feeling completely drained. In some cases, this extreme fatigue can appear weeks before a major heart attack. Ruth, a 70-year-old retired librarian, had always been energetic, but one month she started feeling unusually tired after just a few minutes of activity. She thought it was just aging, but the fatigue worsened. The next morning, she had a strange pressure in her chest, and she was later diagnosed with a heart attack. The exhaustion she had been feeling was actually a warning sign. If you've noticed a drastic drop in energy and there's no clear explanation, especially if it's getting worse over time, don't ignore it. It could be a sign that your heart is struggling. Extreme fatigue caused by heart issues doesn't improve with rest and can be an early signal of a serious cardiovascular condition. 6. Irregular or racing heartbeat. You're sitting in your favorite chair, reading a book or watching TV, when suddenly your heart starts racing. It feels like it's fluttering, skipping beats, or pounding harder than usual, even though you're sitting still. It only lasts for a few seconds and then goes away, so you dismiss it as stress or too much caffeine. But an irregular or racing heartbeat, especially if it happens frequently, could be a silent warning sign of something far more dangerous. Atrial fibrillation, a condition where the heart beats erratically, is one of the most common causes of an irregular heartbeat. It can lead to stroke, heart failure, and even sudden cardiac arrest. When the heart doesn't beat properly, blood can pool in the chambers, leading to dangerous clots. These clots can travel to the brain or lungs, causing a stroke or pulmonary embolism. If you feel your heart racing, fluttering, or skipping beats, especially if it happens repeatedly, don't ignore it. If it's accompanied by dizziness, lightheadedness, or shortness of breath, seek medical attention immediately. Early treatment can prevent serious complications. Conclusion. Now that we've gone over these 6 critical warning signs, it's important to remember that many sudden deaths could have been prevented if the symptoms had been recognized early. Unexplained shortness of breath, chest discomfort, sudden weakness or dizziness, swelling in the legs or abdomen, unusual fatigue, and irregular or racing heartbeat are all red flags that shouldn't be ignored. These symptoms might seem subtle, but they could indicate life-threatening conditions such as heart failure, stroke, or blood clots. If you or someone you know experiences any of these symptoms, don't wait. Seek medical attention right away. It's always better to be safe than sorry, and recognizing these warning signs early could make all the difference. Have you or someone you know experienced any of these symptoms? What stood out to you the most in today's video? Leave a comment below and share what you learned and how you plan to use it in your life. Your thoughts are important to us, and reading your comments motivates us to continue creating helpful content. If you found this video valuable, please like, subscribe, and share it. Your support helps us continue to create content that can inform and inspire. Thanks for watching, and we look forward to seeing you in the next video.